So, today we are going to unpack some of the questions that you wish you could ask your therapist. There are so many different types of therapists out there. Some will tell you about their life, some will not. But what if you had the vault to everything you wanted to know? So, let's get started. I am a therapist and I am happy to answer questions. We also have some fun questions from our listeners as well. So, you were the one that proposed this topic. So, tell me about your curiosity.
I mean, there are a lot of curiosities I have. I think about a therapist personally, but one of the first ones I want to cover, just maybe for our audience, and I know this is something I struggled with understanding a lot when I was first referred to therapy. What's the difference between seeing a therapist and seeing a psychologist? Is that the same or is it different?
So, the difference between it would be good to break down psychologist, psychiatrist, and
Yes.
therapist of various kinds. So, psychiatrist is, I think, the one that a lot of folks get confused about. A psychiatrist is a medical doctor who is going to be providing you prescriptions to address various diagnoses or issues that you're having. And a psychiatrist, I will say, most psychiatrists will not be offering therapy. I'm not saying it doesn't happen, but most of them are there to address symptoms. And sessions can look like 15 minutes on average. I will tell you the craziest thing. My first job ever was at one of those like boot camps where kiddos
Hmm.
were, I was not
Where
living
bad
there,
kids go?
but
Where the
we're
bad kids go?
we're kids. Yeah, I don't want to call them that, but we're kids who were struggling at home and did not have supportive environments were sent. It was specifically boys, the camp that I was at. And the psychiatrist, Dr. Cornwall, he was very intimidating. I would, yeah, it even has like a military name.
Did you see your face right now when you were saying his name?
I can only imagine. I'll have to watch it. But he would sit in this room and I would sit next to him because I knew these boys. I knew their families. I worked with them as their therapist or counselor. And he would have my 15 boys line up, come in the room, ask them about 5 questions. Next, next. And he was in charge of their medication, which is wild. No one else I've ever encountered works like that, however. So, psychiatrist, that's that level. Psychologist is a therapist. They can be a therapist, but they are also a medical doctor. They are a PsyD. They've gone to, at least in the States. I don't know, if the letters change based on where you are. They do residency very similar to a psychiatrist. They offer therapy. Psychologists differ in the fact that universally they can diagnose. Some countries you can't diagnose as a therapist. In the States, we can. We are given
Mhm.
the training and we go through the clinical hours. But for instance, my students in Canada cannot diagnose unless they're in one specific province. Most of them are just offering counseling. So
Okay.
I learned that in one of the practice sessions with my students when I asked why they didn't ask these specific questions about diagnoses. And they said, Dr. Kelly, we can't diagnose. And I said, I have some learning to do. um, good to
But
know.
that's true for South Africa too.
Oh,
My
is it?
psychiatrist, yeah, my
Hmm.
psychiatrist prescribed medication and he made the official diagnosis, but my psychologist um provided therapy and kind of the direction into which he was leaning and thinking this may be the issue, but
Right.
he always referred me to the psychiatrist to make the official diagnosis and to prescribe
Hmm.
the medication. Yeah.
Right. Yep. That sounds like exactly how it would go. Psychologists also are traditionally trained in a lot of testing. So, if you want to see if your child has a learning disability or ADHD, I technically can diagnose ADHD, but um, psychologists generally are trained in very extensive testing. Now, a therapist, then you have this whole offshoot within therapists and counselors. You can have, depending where you live in the States and what your insurance will cover, you can have art therapists, which is what I am. You can have licensed clinical mental health counselors, which I also am. You can have social workers who provide therapy, but they're also usually going to be hooking you up with services, helping you find housing, all of these things. So it's a wide range. And I think if you're looking for the right fit for you, sometimes it's less about what the letters are behind someone's name and it's more about their area of focus. If they, for
Mhm.
instance, really specialize in anxiety, you would probably want to reach out to someone like that. It's a little less important what letters they have behind their name, but I will tell you some people really do care about that as well when choosing. So it's a very personal topic.
Okay. Okay.
Mhm.
So yeah, it's kind of confusing, but good to understand it all. So
Mhm.
I'm always wondering, and I know that you have specific training for this, and I know that you're I think most therapists have therapists.
We've
Is
either
that
gone to
true?
one before or in my program, we were actually strongly encouraged to go to therapy. So I had one on campus. This story is hilarious. He had narcolepsy, which I
Oh
learned
no.
in
That's when
session
you fall asleep, right?
when he fell asleep on me while I was talking to him. It's like, note
Wait,
to
were you
self, don't
saying
fall asleep
something
on my
really deep?
clients. I
Were you
don't even
saying something really
remember.
deep?
I mean, I was probably talking about my family or something. And I was watching, I'm like, oh, he looks so focused. And then I realized, no, it was because he was slowly falling to the side and falling asleep.
Oh my word.
But he did let me know ahead of time. Like he warned me that this was an issue, but I just was thinking, of course, my first go round.
But I know that, again, like I said, I know you have training for this, but I'm always
Mhm.
wondering, how do you deal with this every day, sitting there listening to person after person share like all of this drama and trauma and
Mhm.
not bring it home with you or not take it on yourself at all and completely just leave it elsewhere? Like, how do you do that every day?
You know, I got really amazing advice from my favorite professor when I was in grad school, and she reminded us that we are not omnipotent, meaning we are not God. We can't dictate what happens in our patients' or clients' lives. So she encouraged us to try not to take responsibility for the wins or the losses. So if you
Mm,
get too hooked in on the wins, then you also are going to be hooked to the losses. And so I really try to realize that the onus and the power is within my client and within their choices, and what they do outside of the room is so crucial. So that's important. That's a good boundary to have. I think another thing is being very careful about who you work with. So I realize there are certain types of clients that are more draining to me than others. And so that's the great thing about experience is that I know, give me your highly sensitives, your anxious, your trauma, your substance use, neurodiversity all day long. I'm ready for it. But I noticed that me personally, as a therapist, I'm not as strong in deep depression. I
mhm.
think because as an HSP, the lack of energy in the
Ooh.
room kind of pulls me down. Right. So, and not to say I
Mm,
can't work with a depressed client, but I'm saying when that's like the primary reason, it's just not my strong
mm,
suit. So, knowing where your strengths and weaknesses lie can be really powerful. And I mean, I had mentioned boundaries. Boundaries are so important. And I think boundaries with your time is very important. Only dedicating to hours that you feel you can be at your best, making sure that your clients understand boundaries around contacting you outside of hours, so it's
mm,
boundaries, knowing what your strengths are and realizing that you are just offering that space and that energy within that moment. And when they walk out of the room, you have to let them take charge of their life. You are not in charge of their life. Those things are helpful for me, at least.
mm.
Yeah.
But do you sometimes have instances where you
Mhm.
feel like you are taking it with you, or you're thinking about something that has happened or that they have
Mhm.
said, and you find it a little bit more difficult than other times to release it? Like, for example, I would think that if I am myself, like we all do, going through a more difficult time, and I'm
Mhm.
stressed, and like I may be dealing with my own emotions and family drama or whatever is going on in my life, maybe sometimes it would be more difficult for me to kind of, especially when it maybe coincides a little bit with what I'm going through.
Yes, you hit the nail on the head about what it felt like during COVID, because
Ooh.
my clients and I, for the, totally different, but on the other hand, we were all having this universal shared experience.
Mm,
Sometimes if I have clients who are really moved or deeply concerned about school shootings, that can be a little triggering to me, having young
mm,
kiddos. Um, I do remember a client the other day was going through something that was kind of congruent to something that has been happening in my own life. And I felt it and I recognized it. Sorry. and and I talked about it. I came home. I did not say any identifiers about my client. I didn't say his name or anything. Oh, now I just said his gender. Whoops. But all 4 billion men in the world, I just
mhm.
exposed as my potential client.
Yeah,
um,
busy, busy, busy calendar you have there.
all of them, all of them. But so I did speak with my husband about it when I got home, saying, "Oh, this topic came up. It was a little heavy." So I think having, whether it be a close person that you can talk to anonymously or supervision groups, a lot of us will continue peer work. So in my practice, there's 15 of us, and we meet once a month to process and talk about if we have
Mm.
clients that are triggering issues or that we're having transference. Have you ever heard that term?
No?
So, transference is if you meet with your therapist and there's something about your therapist or the interaction that triggers things for you that maybe remind you of your past or other people or
Oh, I
okay.
had that. I had that
Mhm.
because I was referred to a therapist, wonderful person, but an older male.
Mm,
And that for me triggered my sexual abuse by my grandfather. I
of
I don't
course.
mean it I didn't put it on him at all, but I
Right.
found it very difficult to open up to a person like that because all I could see was
Mhm.
trying to speak to my abuser. I hope
Yeah.
I'm not like saying it in the wrong way.
No, you make perfect sense. Mm-mm. I
So
think it
that's
makes a lot of
transference.
sense. That is transference. But us therapists can experience something called countertransference. So we can
Oh.
have a client who might trigger something in us. It might be, I had a client that reminded me of a family member that I've had struggles with before. And I noticed when this client would come in, I would get a little bit less relaxed. I was a little bit more rigid in how I would say. I'm a very my my clients can attest. I'm a fidgeter in session. I move all over the place in my chair. I'm cross-legged. I'm not, sometimes boots on, boots off. But countertransference, it's up to us as therapists to recognize, is this something that is hindering my ability to be the best therapist for my client? Or is this something that I should process with my peer group, my supervision group, my supervisor? And that's important. Self awareness is very important.
Mm. So I think this leads to my next question, which you don't have to answer if you don't want to, but I've always wanted to ask
I'm going to
this.
try to answer all of them.
Do you ever have days or get clients where you just feel, holy moly, just get it together, man? Like, or women, like there are so many other issues. Like it's like this is so exhausting at the moment. Do you ever
hmm
feel like that, or are you not allowed to? To
Of
well,
course, I'm human. Yes, of
yeah.
course. There's different reasons. One could be if I'm going through something really serious or heavy in my life, and I remember I was going through a literal trauma, and someone came in talking about being unliked on like social media by someone that they liked
Mhm.
or something along those lines. And normally, I can have deep empathy for that because I know it's a metaphor for human interaction. But that day in my mind, I just was thinking, come on. So it doesn't happen often, but I knew why that was happening. I knew that I was having compassion fatigue, which is what it would be
Yeah.
called, because of what was going on. And that signaled to me, I need a little bit more self care this weekend. I need to talk to someone. I need some rest. So that's another way not to bring it home, is knowing when you need extra self care. Um,
Mm.
but the other one actually happened to me yesterday. Yeah, it was yesterday. And I love this client that I'm referencing. I adore this client. I've been working with them for years, but they have a very stressful life and they let their ADHD medication lapse. And by let, I
Oh,
mean there were a lot of factors.
yeah.
And they came in with so much energy and intensity yesterday. And as I was mentioning to you, I'm still a little jet lagged from traveling.
Yeah.
So partway through the session, I just looked at my client and I said, "Okay, time out." I was like, "Can you just take a breath for a second?" Like, I haven't even been keeping up with half of what you're saying. I need a second. Let's do some breathing together. Can we breathe together? So I've been doing this long enough that I feel comfortable and confident also letting a client know if I've missed the boat. If they're on a train and I'm not on it with them, I will let them know. But not all
Mhm.
therapists are as direct maybe, and or that takes experience. I wasn't doing that, my first year, 2, 3, 4, 5 years into it. So,
Yeah. I often get okay, I've been in the therapy circuit for a while, but
mhm.
I've often heard from people who are very opposed to therapy or,
Mhm.
think it doesn't work or whatever leads them to that decision. They tend to always have this idea, which was very much also the idea people had about lawyers, is that the idea is to charge you for as long as they can, as much as they can.
Mhm.
Um, and it's weird how many people think that if you go to therapy, you don't really go to be healed or to get to a certain point. It's like to keep going and keep paying the hourly rate and keep paying it and keep paying it. I don't know, maybe there are therapists like that, but in my journey I found that mostly they will be working with me to get me out of this cycle so that I
Mhm.
can function on my own again and that I don't have to come to these sessions. So do you deal with people like that, and how do you feel about that kind of assessment?
So I think it's multi-layered. I do think it's important to mention culture in this because sometimes the adversity to therapy has a lot to do with cultural beliefs. And there are
Mm,
certain cultures that definitely believe we keep our pain close to our heart and close to our sleeve, and we don't share it because that's shameful. And I think which is not true. The truth would
mm,
be
mm,
share the pain, and sharing our pain, that human collective, is deeply healing. So one thing is I do try to be respectful of cultural belief. I think as far as fields of science go, this field of science is not as mature as some others. It's newer. I mean, if you look at art, this is an interesting offshoot, but if you look at classical art, babies and children were depicted as miniature adults. And that, if you look back at some Renaissance art, for example, and that was because psychologically we didn't understand development and we just
mm.
looked at them that way in certain arenas. And so even in the time I have been in this field, the changes are dramatic over the last couple decades. So I think understanding that people have preconceived notions. It's funny, a really good friend of mine the other day was telling me about a new therapist that he has because he wasn't really connecting with his other one. But I think he's always felt a little uncomfortable about, maybe not uncomfortable, but he's digested some of these notions. And he called his therapist a shrink. He goes, "Oh, I got a new shrink." And I said, Can you tell me? I was like, can you tell me the derogatory term for graphic artist? Because I'll start using that with you now. I was joking
Yeah.
around, but I was kind of like, let's not use that term. It's not exactly, it doesn't,
Yeah.
we're not there to shrink you down and not
Mhm.
feel. That's where the term came from. Um
So you're not into Shrinking, the Apple TV
Oh,
series?
the show. You know what's funny? I
Yeah.
love I love I forgot her name, but the female therapist, she's my favorite on that show.
Oh, I don't know her name. I don't know, but I
I
also enjoy
forgot.
her a lot.
Yes. That show, I'm telling you, he would be either arrested or unlicensed after the things he's doing. It's entertaining though. I love Harrison Ford in that show. So I think culture is important to pay attention to, preconceived notions. Um, and lack of experience with it. And I think COVID, again, to bring up COVID, was one positive that came out of it is that it unveiled the issue, the mental health pandemic, the other pandemic, the epidemic of mental health, and that therapy, in my opinion, should be so normalized that we all have a family doctor, we all have a GP. Why don't we
Mhm.
have a therapist on call that we can reach out to when life gets tough? I mean, it just makes so much
Mhm.
sense in my mind, at least.
Mhm. Mhm.
So there's that piece of it. As far as your question specifically about like length of time, I say this very respectfully. There's no shortage of clients. Most of us have wait lists. Most people
Mhm.
actually have a problem finding a therapist nowadays. It's unfortunate. There's not enough. And so, if there's a therapist who is wanting to work with you long term, it's because, in my opinion, that's the kind of work they do. It's not because they want your money. And it's because I have a 6-month wait list right now and it breaks my heart. I would love to get people in. Um, but I'm more of a
Wow.
long-term therapist. I think working with highly sensitives, I kind of unpeel the
Yeah.
onion a lot. So, yeah, and you know what? Some insurance companies only pay as much as a masseuse makes. So there's that too.
Oh, wow.
Yeah,
Well, I mean, I have many more questions to ask you, but maybe you can share some of the ones you have from our audience.
absolutely. So, I fielded this question to some of our listeners, and a lot of the responses were pretty funny. But one of them was asking specifically whether or not we think they're crazy. that, was,
I
that
would
kind
actually also like to know that. Like
that kind of goes along with what you were saying of come on, man. Um, I would hope the answer would be no. I mean, I think if you do this for long enough and you experience enough human shared emotion, you understand that, in my opinion, actually, the people in therapy are the least crazy ones.
Oh, yay. Okay.
Mhm.
I got
Mhm.
the
Yeah. Mhm. Like you
But
know there's something to unpack, you want to be there for it, you want to
yeah.
process it.
Yeah, that's very true because some of my most challenging relationships have been with people that don't want to see that there is something wrong and that
Mhm.
feels like it's a waste of time to
Mhm.
take care of your kind of psychological well-being like you do your spiritual or your physical well-being. That's
Right.
very true. Wow.
Mhm. Yeah. So,
Good
red
answer.
flag if someone's never gone to therapy
Yeah.
or some form of healing or helping. Another question was a lot of people really are curious about our families and wanting to
Oh, that makes
know.
sense.
Yeah. Have you ever had that where you've just been so curious about like the relationships your therapist has?
Not so much the relationships, but more how the dynamic in that relationship works.
Mhm.
Because everybody fights in a family. You always have disagreements. You're raising kids, you're married, you're not always going to see eye to eye. So, does the therapist come out a lot? Like, where the other party may feel, are you therapying me? Like, does that come up? I've always wondered about that because I think for me, if I were on the other side of the coin, I would always be thinking, wait a minute, are we having like a real conversation, or
Mhm.
am I being counseled?
It's a funny joke that sometimes comes up in conversation. If someone finds out I'm a therapist and we're in a social setting with people we don't know and my husband happens to be there, they'll ask like, "So, what's it like being married to a therapist?"
Really?
Yeah, I mean, and he jokes like, "Oh, well, I mean, we can't help some of us within our personality. Our personality is analytical or deeply empathetic, and so some of our personality, I think, comes out in our relationships. How could it not? Some of that therapy persona, but I mean, for the most part, it's a very different mindset. I joke sometimes that when I'm in therapy with someone, I can't chew gum. Like
Mhm.
I can't be distracted. I need to just be fully immersed in the moment, which is pretty hilarious because outside therapy, I'm an avid gum chewer. It's something I do all the time. Um, Ad for pure gum, which doesn't have all of the chemicals in it. Um, but we'll put the link in the bio. Just kidding. But so I think it's important as a therapist not to try to overhelp all the time, not to think that you are in charge of all of your friends and family's lives. And that means we have to set boundaries sometimes. If someone comes to me and asks questions, I might give them some guidance, but I'll usually encourage them to find a therapist themselves.
Mm, mm. Okay,
Yeah. So that's a tricky
interesting.
one.
Tricky.
Yeah. So one other funny question that I had gotten was, well, I guess it wasn't so much funny, but basically asking like how do we unpack what are the crazy things we do outside of session? Like are we yes, like are we going off and doing the things that we're all recommending our clients don't do?
Ooh, yeah, that's a good one. Do you?
You're like, "Hmm." Um It's funny because I have not run into many of my clients outside of session before. And so it makes me think sometimes, what if I did in these scenarios? Like, would this version of me match the version that they have of me sitting in the office with them? I do remember hilariously being super gross and sweaty after the gym. I was just wearing like gym clothes, no makeup. And I was walking through the grocery store with a giant watermelon in my hands. I don't even remember why I was buying it. And all of a sudden, I turn the corner and smack right in front of me is one of my methadone clinic clients. I used to work in a methadone clinic for a period of
Yeah?
years. So one of my substance abuse clients, and not that that necessarily matters, but the vibe at the place I was super clinical. That's why I bring it up because if I ran into one of
Okay.
my clients now, I think it's a little bit more laid back and
Mhm.
organic at my practice. There's I am all over my room. Like you kind of get the vibe of who I am. But at the practice that I was at where I knew this client, it was very medical. And I
Okay.
remember him just turning the corner and we kind of looked and he's like, "Hey, you?" And like it was like being seen. I don't want to say naked, but you know what I mean? Like it was just so
Yeah.
exposing. And then he proceeded to have a whole 15-minute conversation with me while I'm holding this like incredibly heavy watermelon.
Oh,
And
no.
I just was thinking, okay, I got to go, but I didn't want to say that because we cannot contact you or say hi to you or reach out to you in public. That's against our
Okay.
license. It's a privacy thing, but you can go up to your therapist. However, that's tricky too. I mean, therapists want to set those boundaries. um,
Mm.
I will say sometimes in social settings, I'll have someone ask me if I can work with them as a therapist. And I joke that if I've had a glass of wine with you, I can't be your therapist. Like,
Oh, I think that's a good rule.
yeah,
Good rule. Solid rule.
yes, exactly. So we're just people, really.
Yeah,
Mm-hmm.
that's very important to remember because I think when one finds oneself in therapy, there's a lot going on in your own life and in your own mind. And
Mhm.
I think you often look at your therapist as this almost like person on a pedestal that's kind of doing it all right and knows how to do it. And
We're not.
you're going to get there one day. And it's important to remember that we're all just people and on a journey, and we're all just trying our best.
1,000,000%. Mhm. Absolutely.
Do you have any more questions for us to work through, or can we celebrate what we are celebrating for today?
I think celebrations would be great because at the end of the day, the majority of the questions are all very related to people just being curious about the person sitting in the room holding space for them.
Yeah.
So I think I would encourage listeners, if you're working with someone and you have curiosities, each therapist is different. Sometimes you can ask your questions and it can build your relationship. And then other times there's going to be therapists who have a certain approach where they want to keep really strong boundaries and they don't go there. So it's good
Mm.
to ask your therapist how they feel about self-disclosure and how they feel about creating that connection. And if you are a therapist listening, it might be a nice thing to share with your clients because we all have
Mm.
different approaches. So,
Mm. Okay, that's awesome. What are you
mhm.
celebrating today or this week?
Ooh, let's think. I am celebrating getting back into the country in one piece.
That's a good celebration. That's a good thing to celebrate.
Yes, and I am going to try never to take American through Miami again because this is not the first or second, but it is the third time I've had an issue in with
Oh
that
no, wow.
specific scenario. So yeah, I'm gonna maybe look into JetBlue next time.
Oh yeah. Okay.
No offense, American. What about you?
So I am celebrating this week. Oh, I'm actually celebrating the launch of my new community, The Anxious Calm. I've been
Oh,
working so
that's so
hard on it, and
exciting.
it's been so stressful to launch it. It launched last night.
Okay.
So it's an online community with courses and content and offering for anxious overachievers like me.
How cool.
Yeah, so I'm celebrating that.
Can you send it to me? Because I haven't seen this and I would
Yeah,
love to share it with my
yeah.
clients.
Yeah, for sure. I'll send it to you for sure.
That's fabulous. Congratulations.
Thank you so much. So, thank you for joining us again here on the Sensitivity Doctors. This was such an informative episode, and we have many more amazing episodes to come.
Absolutely. Thank you, everyone.